Hello everyone. So today I'm going to discuss a video which is in continuation with the previous video. In the previous video we had a discussion on hysteroscopy, that is a view inside the uterus. Now today's is going to be the laparoscopy, that is view outside the uterus. Okay. So we know that it is used to view the uterus, fallopian tubes and ovaries and to make corrections in the same sitting. Now this is a very big advantage because laparoscopy is not only diagnostic but it is very much therapeutic. Okay, and that is why it is known as minimally invasive surgery. Why minimally? Because see, this is a camera, alright, this is a camera and the size of the cut which we make here is only 10 mm. How much? 10 mm. So that is 1 centimeter only. Okay, and most of the times if it is made through the umbilicus, even the after surgery, even the stitch is not visible, and along with that accessory ports are put through which we put the instruments, and the size is only 5 mm. So it does 5 mm does not even require any stitch or any kind of suturing for it to close, because it will heal on its own. So that is why it is called as minimal invasive surgery. Uses only the small cuts, unlike open surgery, and that is known as the laprotomy. Okay, so that is the difference between laprotomy means a big cut is made and laparoscopy means only small holes are made. Okay, so now if you see, this is a view, this is a camera which is being put from above the abdomen, and now again you can see this is a uterus. Okay, this is a uterus, in front is the bladder, behind is the rectum, and you can see this is a fallopian tube. Okay, this is a fallopian tube, here is the ovary. All right, so now what does it mean? That any problem in the uterus, in the fallopian tubes, in the ovary, okay, this can be dealt very nicely with the help of laparoscopy. Okay, now what is the process for doing it? So of course it is done always under anesthesia. Okay, in laparoscopy always anesthesia is required, and then first of all we will put the laparoscope insertion, and then we will create, the second thing is a pneumoperitoneum. Pneumoperitoneum means what? We are putting a CO2 gas which is going to distend, okay, which is going to create space inside the uterus abdominal cavity for the surgeons to do the surgery. Okay, the third process is then we connect the light source and we put other ports which are made by 5 mm under vision. Okay, and whatever the surgery is required, we are operating it, and at the last we are taking out all the instruments, and then we are putting small stitches if required. So this is a process of doing the laparoscopic surgery. Now what are the various indications? Now this images are particularly for the infertility things. Okay, so remember, most common cause of infertility is also pelvic inflammatory disease, in which the patient will keep on having chronic pelvic pain, there is chronic white discharge, or sometimes there are other features which we will see right now. So second is endometriosis. Now endometriosis is gradually very much increasing in incidence, and more so it is affecting the fertility potential of the females. Endometriosis can now have even a multi-compartment syndrome, that is, it is involving even the bladder or the rectum. In such cases, accordingly the surgery has to be done, but endometriosis ideally can be taken up by the laparoscopy. Coming to the fibroids. So remember, fibroids location is very important besides the size also. So if small fibroid is indenting inside the cavity, okay, even that is a problem, but a huge subserosal fibroid may not affect the fertility potential. It might cause some other problems like its mass effect can be there, it can cause pressure on the bladder or the bowels, but usually the subserosal means arising from the surface of the uterus, usually that does not cause infertility, but any small fibroid also which is indenting into the endometrium cavity will affect the implantation of the embryo, and hence it has to be removed, and the location will decide that the approach can be by hysteroscopy or by laparoscopy. Okay, now next is ovarian cyst. Now ovarian cysts are of multiple types. One of the common is endometrioma cyst, that is known as also chocolate cyst. Then there is dermoid cyst, sometimes simple cysts are there. Then sometimes para-ovarian cysts are also there, like adjacent to the ovaries. So all these cysts can be very much dealt and removed very nicely with the laparoscopy. Coming to ectopic pregnancies. So we know what is ectopic pregnancy. Implantation of the pregnancy outside the uterine cavity, the most common location being the tubes. And in most of the cases the tube is completely damaged, and hence the full tube usually has to be removed. So in such cases, in future the patient can, if the other tube is normal, can become pregnant from the other side. So ectopic pregnancy very well can be done by laparoscopy. One of the other indication is hydrosalping. So hydro means water, salpings means tube. So when there is a water collected inside the tube. Now this tube is of course non-functional, but the other disadvantage is that if from the other healthy tube the patient is able to conceive, this water inside is not a good water. It is toxic to the implanting embryo, and hence it will not allow it to implant only. That is why this tube definitely has to be removed. So besides all these indications, another very common gynec indication is removal of the full uterus, okay, that we known as total laparoscopic hysterectomy. So these are the various common indications for laparoscopy. Most of the surgeries are done under general anesthesia, as I told, and the recovery thing is very nice with laparoscopy. Very minimal painkillers are required, very minimal bed rest is required for these patients, and the patient is mobile the same day. That is a very great advantage. Sometimes because of the surgical challenges, maybe the operating time be a little more, but the recovery is very much faster than laparotomy. Okay, so always one should consider laparoscopy over laprotomy. And of course, the final decision should be a mutual consent between a doctor and the patient. Thank you so much.